when the medication wears off, and in my case, the medication has a tendency to wear off earlier than what the doctor has prescribed for me to take the medicine. In other words, if I take the medicine every 4 hours, the last hour of that 4-hour span is usually a time where I get very, very stiff.
Every morning when I wake up, I can either just go to the bathroom, come back, take the medication. Some mornings I wake up, I cannot. I just stand and I freeze.
So for people caring for you, that would be very frustrating because you just can't move.
I'm telling you, I freeze. That if I didn't have my husband there with me to give me the bedpan, I would just wet the bed or wet the floor.
The drug of choice for controlling the disabling symptoms of Parkinson's disease is a combination of levodopa and carbidopa. The purpose of this film is to illustrate the long-term side effects of levodopa therapy and present options for nursing care of patients experiencing these disabling reactions. At the completion of this discussion, you should be able to recognize and report these reactions to the consulting pharmacist and physician. Identify specific nursing interventions for these patients experiencing these effects and instruct their families how to cope with them. Since the impact of long-term side effects are often observed but poorly understood, let's review how these symptoms manifest themselves. Anticholinergic effects are the first and most commonly reported drug-induced effects, which produce dry mouth and constipation. This effect may also result in difficulty in swallowing and choking, which in turn may alter nutritional status. Damage to teeth occurs frequently due to the absence of saliva.
I have a little trouble with my teeth. They don't bite as sharply as they used to, and I've lost part of some molars, and I'm very worried about that.
Nursing interventions for this problem include frequent mouth care, lubricating the mouth, brushing and flossing the teeth, swallowing exercises, adequate fluid intake, 8 to 10 glasses of water per day, increased fiber intake in the diet, daily exercise to maintain and improve abdominal muscle tone, and setting a pattern for evacuating the bowel by going to the bathroom at the same time every day after a meal. Another side effect, which may be confused with tremor, is dyskinesia, which appears as an abnormal, involuntary dance-like movement of the head and limbs. These movements include grimacing, inadvertent jerking or squirming, as if the legs or arms were dancing out of control. Nursing interventions for these problems include reviewing the dosages of levodopa, which may need adjustment, reporting these movements to the consulting pharmacist and physician, maintaining mobility, and preventing contractures by assisting the patient with range of motion exercises every day, and ensure safety by moving the patient to a comfortable place. End-of-dose failure and on-off syndrome can be the most disruptive side effects of long-term levodopa therapy. End-of-dose failure is a predictable fluctuation to the levodopa response. It occurs at regular intervals after the last dose of levodopa. This wearing off of response usually manifests itself in repeated dance-like movements of the head, neck, trunk, and limbs. Pronounced disabling tremors also occur. Since these manifestations are predictable, they can be avoided by readjusting the medication schedule.
Now, once the tremor leaves, I can just do anything that I want to. I feel great because thank God, it's a tremendous sense of relief.
On-off syndrome, unlike end-of-dose failure, is a sudden, unpredictable fluctuation in response to chronic levodopa therapy. It is not related to the timing of the levodopa dose. It is an abnormal response to the levodopa dose, which must be adjusted. During the on phase, the Parkinson's symptoms are suppressed. Then, with an abrupt change to off, the disabling symptoms of Parkinson's disease reappear: tremor, bradykinesia, rigidity, and postural changes. Both end-of-dose failure and on-off syndrome are devastating to the patient. Usually, the patient can do nothing, and nursing intervention is an absolute necessity to even carry on the simplest functions of activities of daily living.
When the medication wears off, and in my case, the medication has a tendency to wear off earlier than what the doctor has prescribed for me to take the medicine. In other words, if I take the medicine every 4 hours, the last hour of that 4-hour span is usually a time where I get very, very stiff.
Activities have to be planned to improve function, prevent frustration, and maintain social contacts. The risk of injury, especially falling, is at its highest during these periods. Falling is a common occurrence with Parkinson's disease, which very often leads to serious injuries: fractured hips, wrists, limbs, ribs, etc. Is there anything special you are aware of to prevent falls?
Yes, walk slower.
Walk slower. And you find that helpful?
I find that very helpful. You have to, when you come to a corner, you have to make a wide turn. Don't make any sharp turns.
So taking wide turns at corners is helpful?
Right. It's essential.
How about when you feel yourself going down? Is there anything you can do to protect your body from damage of a fall?
You try to fall away from your hips.
And protect your head.
Because if you get a hip injury, you're dead. I just, last week, I took off the cast and the broken wrist I had from my wrist 4 weeks ago.
Teaching and training patients how to prevent falls is one of the highest priorities in nursing care for the patient with Parkinson's disease. Be sure to make the following recommendations to your patient. Think before getting up from sitting. Look up, face ahead, don't look down, or turn your head while walking. Prevent distractions and don't talk while walking. Keep your hands free. Throw items away from your body if you're feeling like you're going to lose your balance or about to fall. Be aware of the changes in the floor surfaces and ground levels. Remove furniture and obstacles from walking pathways to ease mobility. Walk slowly around corners. Don't turn sharply. Wear comfortable shoes and lift your feet. Sneakers may cause a braking action. Use of handrails, grab bars, non-skid mats, and night lights may also help to prevent injury. Freezing is a temporary inability to move. It is a sudden difficulty in walking, particularly in turning or walking through a doorway, moving from room to room, or sitting in a chair. Nursing interventions to unfreeze patients include slapping an object or clapping. The noise or change of concentration may help.
For instance, when I do my daily exercises, I end up jumping in the air 180 times. And sometimes I can't get started, and sometimes I get started only in the middle.
In the middle.
And what I do is I slap a chair. That releases everything.
And releases the freezing.
Yeah.
Chanting 1 and 2 and 3. Music and cadence may help to restore rhythmic gait. Imaging and visualization, thinking about moving before walking. Verbal commands such as move or take a step. Always exert a gentle touch. Don't push or pull the person. It will not help and may cause the person to fall over. How do we, as nurses, combat these effects? First, the pharmacist and the physician should be consulted in order to readjust the patient's medication schedule for the end-of-dose syndrome or the change of the levodopa dose for on-off syndrome. The nurse's responsibility is to see that the meds are taken on time in order to maximize the effect of the drugs and to provide the most on time for the patient.
During the day, I'm able to function. And just the past month or so, I have gotten this off period again.
You have?
Where I freeze.
Just freeze.
Not only freeze, it has come on me just like that, like a snap that I don't even know what's coming on. And that I have found.
So sudden off.
It's a sudden off.
Yeah.
And you know when I found it? If I had forgotten to take my medication. If I don't take my medication on time, that is the most important thing. I was a half hour late.
And that's all the difference in the world.
It made the whole difference in the world, that half hour.
Meds must be given on time, much the same as insulin is given to diabetics. Second, establish a low and slow dosage schedule of levodopa with Parladil to lessen the long-term effects of high-dose levodopa therapy. Parladil extends the effectiveness of anti-Parkinsonian control with levodopa. Unfortunately, many patients have been on high levodopa therapy for a long time and may have difficulty lowering the dosage since Parkinson's disease symptoms may reappear. Parladil, as an adjunct drug, can facilitate lowering the levodopa dosage. Third, drug holidays are the systematic withdrawal of all anti-Parkinsonian medications. At one time, it was thought that this could prolong the effectiveness of levodopa therapy, but it has been observed the risks do not outweigh the benefits. You had mentioned at one time in your life they had put you on a drug holiday. Could you describe a little bit of what that was like, how that felt?
Well, we started cutting the dosage for 2 days, bringing it down to 0. And the only way I can describe it is I know what it's like to die.
And could you tell me what that felt like?
Complete weakness. I could scarcely get out of bed. And was shaking at every step.
When medications are withdrawn, all Parkinson's symptoms return, including severe immobility, slowing of the bowel, breathing difficulties, choking, and swallowing problems. This process should only be done in hospital under the strict supervision of a qualified neurologist. It is risky, and you should discuss this with the physician and patient before this process has begun. Fourth, the effect of protein on the absorption of levodopa has been studied. Rich protein meals may block or delay the absorption of levodopa.
And then there have been some studies that you should cut down or cut back on the amount of protein that you eat. So I have been doing that and trying to have less protein during the day and maybe have enough protein in the evening when it's a better time to eat more protein. Not everybody responds to that, but I think having a well-balanced diet with low protein during the day is probably a good thing for most people.
Yeah. Do you find that it improves your function a little bit, or?
It does. I find that the medication works better if it doesn't have to fight with the protein that you do eat.
Working with nutritionists, you can plan appetizing meals with adequate caloric intake and the minimum daily requirement of protein to decrease the possibility of this interaction, with resultant adverse effects on absorption. Fifth, the last and perhaps the most important intervention is to assist the patient to maintain a daily routine of exercise, to maintain flexibility, coordination, and balance. It is not enough just to instruct patients in various types of exercises. For comprehensive evaluation, a return demonstration on the part of the patient is necessary. For successful outcome in the management of Parkinson's disease, a program of comprehensive therapy and balanced medications is necessary. These long-term patients, with disease courses ranging from 3 to 17 years, have been able to maintain activities of daily living and social participation.